Every child comes from a unique set of circumstances. It is critical to recognize that not every individual has the same opportunities as someone else their age. As a result, the presence of educational and other support systems, like the Youth and Addiction Services, play a significant role in the lives of the youth that are impacted.
There are many different programs and supports for youth and addictions. A few of the services that some places may offer could be family services, individual treatment, group treatment, rapid access, addiction medicine, also known as RAM, and psychiatric consultations or local crisis numbers, and many more. Each of the following services can be accessed by contacting a medical physician or a crisis hotline like Good to Talk, Kids Help, and Ontario Drug and Alcohol Helpline. Those are some of the most popular ones in Ontario, and all those services are covered by OHIP. However, if you are reaching out to private facilities like rehabilitation, detox treatments, those ones would be around $600 to $1,000. If you were to do a detox treatment, that could range from $1,000 per day in a private facility. However, sometimes insurance can cover those treatments as well. However, if the problem is serious, contacting a family doctor or medical physician is recommended to get help immediately. If it's not a very serious problem, also recommending a counselor or someone to talk to for that child so that they're able to talk to someone if they're not comfortable with the crisis helpline. To access these services, you would just either contact your family doctor or a medical physician that the child trusts, or even like a counselor or a crisis helpline. A crisis helpline would be more effective because they would be able to find places in your area that you can access, and they can tell you which places are for your needs or for that child's needs, and so on and so forth. So the ministry that overtakes this youth and addiction services would be the Ministry of Children, Community and Social Services. What they do, they provide policy oversight and funding for Ontario Child Benefit. They also oversee health screening and intervention programs that support early child development, and they help families get the help they need. How do they do it? They provide support and mental health treatments for youth. So like mental health hotlines, rehabilitation services, or group therapy, or just counseling at schools. They also provide free services. So like OHIP helps them be able to get the services they need for free. So like counseling or therapy if need be. The Ontario government has also invested millions of dollars to make sure that the wait times aren't so long anymore. So there should be an improvement on that. Since COVID-19 has started as well, Ontario has invested in $194 million in emergency funding for mental health and addiction services, including virtual supports. That's able for 101,000 Ontarians to access. They've also invested $23.6 million to support internet-based cognitive behavioral therapy.
In a study conducted by Russell et al. In 2019, they interviewed 137 participants, all youth, from 11 different communities in Ontario, and discovered that the primary barriers for adolescents accessing or reaching out to addiction treatment services were personal barriers, social, structural, and physical barriers. In terms of personal barriers, many of the participants mentioned that they had no idea that there were these kinds of services for adolescents or the youth, and they mentioned that they were unaware of services available, how to access them, or how to navigate the system. They also showed apathy towards treatment, which is very common in adolescents. Many also mentioned that they were not ready for treatment. They said that they were not ready to leave drugs, that they wanted to continue to use drugs and party and hang out with other friends that were also users. Many of these teens were also in denial of their addiction problem, and they believed that they could handle it on their own, such as handling mental health problems and how they utilize their drugs and addiction. Another barrier is social barriers, and here we see a lack of confidentiality, which is very problematic. Many of these were small communities where professionals would talk to each other about their cases and the information would leak into the community. Many teens were worried that their friends and family would find out that they were looking for treatment, which would in turn create judgment towards them and stigmatization, which was a deterrent for accessing these services. Another problem was the authorities or Children's Protective Services becoming involved, as well as peer pressure to skip treatment and do drugs. Many teens said that even their uncles would tell them to skip their treatments, and systemic discrimination among service providers. This was especially problematic in hospitals, where many mentioned that if they were to reveal that they had an addiction problem, the treatment from nurses or doctors would be different in these hospitals. In terms of structural barriers, long waiting lists was the most important one in terms of deterring teens and youth from accessing these services. And this also goes in hand with lack of services in small communities and lack of staff. Lack of staff in service centers leads to long waiting lists because there is such a demand in some communities for accessing these kinds of services. Another big problem was no connection to further services for continued treatment. This was especially problematic because many would go in for a detox treatment, wanting to get clean, and once their detox time was over, they were released with no connection to other treatments where they could treat their mental health to prevent relapsing into addiction. Also, limited hours of operation. They would work 9 to 5 on weekdays, and on weekends it was closed, which was a problem because 2 days being closed was necessary for some people who wanted to access services on weekends. And extensive administrative requirements to access services. Some of these people wanted to get service and they were unable to because some of them are homeless and don't have the proper documentation with them, and they were denied access to services if they did not have the proper paperwork. And lastly, physical barriers included geographical isolation. Some of these communities were in very isolated areas where service centers were not located and they couldn't access treatment easily. Lack of transportation, where buses would not reach their communities and able to transport them to their sessions. And lack of weather-appropriate clothing. Many said that in the summer it was fine to walk 20-30 minutes to their treatment session, but in the winter it was nearly impossible without proper snow boots or snow jackets. Some of the gaps in the system relate to the barriers, like the lack of awareness of addiction services and what they do. This deters people from being able to access these because they are completely unaware that there are services to provide them with help. Not enough service centers for the youth. This also is a big gap because many don't know where they are located, even if they do know that these services exist. Bureaucratic and administrative inconsistencies where people would want to access services, but they didn't have the proper paperwork, so they were sent back. Or if they did have some of the paperwork, they were asked to find more documentation in order to be able to receive service, and sometimes even showing the proper paperwork, some of them were denied. And lack of communication between services and programs. This is a great gap because many would get clean and then released back into society and not given the proper tools to prevent relapsing, which can be very dangerous and lead to overdoses.
When focusing on the reforms, there are many different ways and strategies that could help enhance or improve the youth and addiction services. Starting off with the location of facilities, in most cases, location seems to be more of a problem when it comes to the service facilities. If a facility is not in close range of an individual and they may not have their own transportation, this could make them unable to access the help that they may need from that service. This could be improved by opening more facilities within a close range of individuals. They do not have any challenges attending the service that they may need. Next is economic barriers. As for the economic barriers, many individuals do fail to meet the requirements, if there are any, which may allow them to qualify for a potential wait list. Also, with the wait list, if one is presented, those individuals may not always be guaranteed enrollment or eligibility. For systemic barriers, removing systemic barriers would also be a huge improvement, as this barrier could be caused by racism. Not every individual may be treated the same, like indigenous people, etc. So by moving this barrier and making it more fair for others as well, may have a huge improvement for this service. Another suggestion would be a diverse team or staff. Having a diverse team would be a great improvement for this service as well. Having staff that represent the facility well and allow individuals that are seeking support to feel welcome and safe. And finally, making sure that this service is economically affordable, since there's certain circumstances in which individuals are unable to afford the service, making it more economically affordable for those that may struggle to find the funds. And by making this service economically affordable, it puts those into consideration who may have a rough time paying.
As a group, we learned that it can be hard to access different services because of the waiting times and the access to them because they can be very limited in many occasions. There are also many barriers which can possibly prevent someone from being able to access the service they may need. They may not be able to afford it, and in addition to the limited availability to some of the services. And lastly, some service providers don't have much contact between their different treatment teams or services, and their clients aren't referred to continuous treatment, which can be very problematic and dangerous for the young teens wanting to get clean and to continue to stay clean, because mental health treatment is very important in addiction, not just detox treatments.